These are long days indeed.
Could you recount the first few days? How did you manage to handle the crisis?
District Medical Officer, Dr. Shija, she called me in the midnight and told me that three persons who had visited China, who had been to Italy, and their two close contacts. So 5 persons in all had become positive. Already we had our district control room set up and running. On 8th morning, what happened was our district collector, Mr. PB Noor, he actually called up a rapid response team meeting. We 8 to 10 teams from consisting of community medicine experts, medical doctors from our various PHCs, and field staff were deployed to this place. The place is called Aitala in Rani Taluk. By evening, our health minister, Shailaja Madam, also came to Pathanamthitta and verifying the CCTV footage, looking at registers of stores where these people had gone to to recharge their phones, and seeing the numbers, 2 to 3 numbers before their number and 2 to 3 numbers after their number, which were recharged.
Pathanamthitta has ensured to strictly enforce these quarantine norms and especially social distancing norms, and that is the reason several health officials said that they could contain the spread of the virus. So how did you manage to convince people to strictly adhere to a protocol?
The community medicine team of Trivandrum Medical College had devised a questionnaire of 20 questions, which could be used to assess and identify people who are likely to break quarantine. With the help of community volunteers and the panchayats, we were able to meet their non-medical needs. Essentially involved provisions for home, uh, baby food, even cattle feed. An Asha and a neighbor was put in charge of home where the person is supposed to be on quarantine, and they would give us information as and when these people broke quarantine.
Was there also any GPS tracker system to keep a check on those who are in quarantine, sir?
We did not implement a GPS tracking system. What we did was geo mapping of the households of these people. That was to actually identify the areas where we needed more volunteers, where more resources were to be mobilized.
If a person is tested positive, what is the step-by-step procedure that the district administration takes?
We have a block COVID control nodal officers. The state protocol is to test symptomatic, but we have slightly expanded upon it. Whenever a case is reported in any part of Kerala, we will also get the history of that case, and we will identify from where this person might have got an infection. So we check for people who are on quarantine in our district who have similar history. So it is only because of this that we got 2 persons as positive cases who are actually asymptomatic. Also, since the end of March, when the Nizamuddin Marcus came in the news, we started testing people who are returnees from Delhi as well. Based on that surveillance, we also got one girl who was positive. Her only contact with Nizamuddin was that she took a train out of Hazrat Nizamuddin railway station.
Okay.
So, and she was also essentially asymptomatic.
With respect to testing kits, personal protective equipment, medical professionals, is Pathanamthitta equipped to handle the coming months?
Currently, the testing is being done at State Public Health Lab in Trivandrum. Our Member of Parliament, Mr. Anthony MP, has given us funds to procure rapid testing kits. Our COVID care centers are almost ready. We have 2,000 beds ready across the district. We are in the process of setting up COVID first line treatment centers, nearly 1,000 beds per taluk. That comes to around 6,000 beds in the whole district. We have identified hostels, hotels, schools, and other infrastructure that is available to actually put people who are healthy but who need quarantine on essentially institutionalized home quarantine, basically.
Okay.
For travelers who will be coming into Pathanamthitta district after the lockdown. And we have two hospitals which are actually identified as COVID hospitals. Our General Hospital Pathanamthitta and our District Hospital Koyanjeri being equipped currently with intensive care beds. We have mobilized ventilators. We have got CPAP machines also, which are being sponsored by various businessmen in our district. District administration has started local manufacturing of personal protective equipment, local manufacturing of masks, and local manufacturing of face shields.
The Kerala Health Minister talked about the recovery of the 93-year-old Thomas and the 88-year-old Mariamma. And in fact, when I spoke to the grandson of the couple who was also tested positive, 9 people in the family, he told that when they first entered the ward, they were extremely scared. They were very tensed because they were told that COVID-19 means it's the path to death. But it was medical professionals and counselors who told them that it was just another virus.
Our isolation facilities were basically Spartan facilities initially. It's basically a room with a bed and nothing else. So once we started putting patients in, we understood that they needed some more things to improve the quality of life, because they were going to be spending 14 to 28 days of their life in that room. So many sponsors came in. They started giving us books, newspapers, and other things to read. A few of them provided Wi-Fi hotspots as well, free of charge for the patients to use. Also, our medical team, they were very considerate, and they spend a lot of time with these people.
What do you think is a lesson that other districts in Kerala can learn from Pathanamthitta and other states can learn from Kerala?
I think it would be the teamwork. We essentially had our whole team up and running in a matter of 2 days. So everyone had role clarity on what is to be done and what should not be done. We have 10 health blocks in our district. We divided these 10. We put one medical officer from a PHC in each health block to be designated as a COVID controlled medical officer. So each health block consists of around 6 to 8 primary health centers and 1 or 2 community health centers. Usually, when such a health emergency happens, it is only the function of the health department to get it under control. But in Pathanamthitta, with our district collector's leadership, we were able to rope in all departments, including revenue, labor, panchayats. Everyone came together.
One thing you wish, as part of the administration, you all wish you could have done something earlier or something better, or if you were equipped with certain technology, you could have handled a situation better.
I think that will help administrators as well as clinicians both on the same at the same time, because it will help administrators identify where they have free resources and accordingly manage patient traffic. One word of advice would be to stay at home and listen to your health providers.